A wide-ranging inquiry examining Australia's COVID-19 response has found delays in obtaining vaccines cost lives and heavy-handed measures eroded public trust. 26 recommendations have been put forward to guide governments through a future crisis.
January 25, 2020, the day the first COVID-19 case was detected in Australia. No one could have predicted what would follow. More than 21,000 COVID-related deaths in Australia and 7 million worldwide. An Australian inquiry has investigated what lessons can be learned before the next crisis.
Our pandemic plans were grossly inadequate for the scale of the challenge that COVID-19 presented to us.
More than 2,000 public submissions were put forward, including 300 from various organisations. 26 recommendations have been outlined in the report that was launched in September last year. It includes a mix of immediate and medium-term actions.
We have to learn the lessons of the past.
Trust was a major theme. Tough restrictions enforced by governments around the country might not happen again.
Has driven a large decline in trust, which the panel members say, and these are their words, means that many of the measures taken during COVID-19 are unlikely to be accepted by the population again.
Major decline in key workforce areas will also pose a challenge due to burnout and the impacts of the previous pandemic.
Right now, we are arguably worse placed as a country to deal with a pandemic than we were in early 2020 for a range of reasons. Firstly, because there has been really significant scarring on our healthcare systems and the health workforce.
Equity was another key pillar. The report found everyone faces higher risks and negative impacts during a health emergency, but some groups are more vulnerable than others. One focus group participant said, "I had my entire family move back in with me, including my ex-partner who was abusive, and the whole situation was just so traumatising." Another added, "They didn't consider us as human. We are just some aliens who don't belong here. No rent help, no food help, not even a single penny. I've been surviving with my superannuation money till now."
The inquiry report points to a lack of transparency around the rationale and the evidence behind decisions that were taken by governments that had such a profound impact on the lives of Australians.
The report called on governments to minimise harm by addressing critical gaps in health recovery and boosting mental health support. It also found the vaccine claim scheme should be reviewed.
The impact of the slowness of our vaccine rollout, something that's been the subject of lots of commentary. The failures in aged care, particularly in that first year in 2020 when so many residents of aged care facilities, particularly in Victoria and New South Wales, were lost to us, and the stark inequity between the experience of particular groups in the community.
The report also recommended the Centre for Disease Control be made permanent. $251 million will be spent making this a reality from January 2026. The CDC will not have the power to direct states, but it will be able to
provide fearless advice to the community and to governments that I think will have a reporting function to Parliament that will be transparent, I think is a critical central ingredient in rebuilding that trust.
The Prime Minister's office and Cabinet will now spend some time working through all 26 recommendations for change.
Trust is easily lost, it's hard to regain, so this is going to be a long, hard process.
Georgie Dickerson, Sky News.